My name is Dr. Camilla Toscano Underwood. I'm one of the current F2s in paediatrics. Dr. Valabanini has asked me to do a quick presentation for yourselves on the importance of a neonatal history as part of the paediatric history. Long term, I want to specialise in obs and gynae, so this is a subject that's quite close to my heart. So I will start with a presentation. So why is neonatal history important? Well, it may give you information relating to what may be causing their symptoms. And this is particularly true if the child is quite young, so within the first days, weeks or months of their life. Depending on the age at which they were born, they may be more at risk of certain conditions, especially lung conditions, but also certain other conditions as well. And it may change our management. So the main sections of the neonatal history are the kind of pregnancy itself, the birth history, and then also the immediate time after birth. So in terms of prenatal and thinking about mum, so first of all, did mum have any infections during her pregnancy? So the main ones that we're concerned with are rubella, cytomegalovirus, parvovirus, chickenpox, and toxoplasmosis. And this is because we know that these infections carry the highest risk to baby and can leave them with long-term effects of that viral infection. It's also important that we know whether mum was on any medications. Medications can have a range of effects on the baby, and some particularly important ones to know about are anticonvulsants, lithium, certain antibiotics, warfarin, and ibuprofen and ACE inhibitors, because these will have wide-ranging effects on the baby. And also, we want to know about mum, whether she had any complications with pregnancy, so specific to pregnancy, such as gestational diabetes, because this can make the baby either larger or smaller than we would anticipate, and that can cause issues either at birth, if it's a larger baby, or if it's a smaller baby, they might have less reserve in that postnatal period. And also preeclampsia, which poses a risk both to mum and baby's health. In terms of prenatal, and so during the pregnancy, we also want to know a bit about baby. So the results of any screening tests that mum went through, whether these were blood tests or ultrasound scans. And did mum need any extra scans? So was baby big or small? Were there concerns about the placenta, either the site of the placenta, the functioning of the placenta, concerns about the amniotic fluid? So was there too much or too little? And concerns about blood flow to the baby as well. The next main section in the neonatal history is about the birth itself. So we want to know about the length of labour. So was mum in a quite short labour or prolonged labour? Did her waters go a long time before she went into labour, and did she need antibiotics for that? In which case the baby might have been more at risk of certain infections. And then if mum had a normal vaginal delivery, was it assisted? And if so, was this using von-2s or forceps? So this is important, especially with the von-2s, because if the baby's presenting with jaundice and they have the chignon on their head from where the von-2 suction cup was applied, this is a potential source for their ongoing jaundice due to the breakdown of the red blood cells in that chignon. And if they had a C-section, why did they have a C-section? Was it planned or was it elective? Did the baby go into fetal distress? These are all really important things to know because it can give you an idea in terms of the health of the baby at birth. Also really important is the gestation at delivery. So the main landmark we can have used as term is 37 weeks. So under that is deemed preterm, and obviously every week or even day earlier than 37 weeks can have implications long term. Obviously, if it's under 30 weeks, then we want to know days as well as weeks. Also important is the weight at delivery. So how does that compare to their current weight? So we know that babies will lose a small amount of weight after being born, that's normal. But if it's significantly lower, then we do need to know about that. Also, if they were small at delivery, they might be more vulnerable to certain infections or just generally have less reserve. And if they were a larger baby, then they might be more at risk, of birth defects. Mum may have needed an assisted delivery as well, and so that might have had implications for baby. And lastly, in terms of the neonatal period, the main thing we want to know is, obviously, did they need any time on NICU or SCIBU? But mainly, did they need any help with their breathing? If they did, was that CPAP? Were they intubated or was it high flow, and for how long? Potential causes of this might be transient tachypnea of the newborn, immature lungs due to prematurity. It may be linked to labour, so if they were born via C-section, or it might signify an underlying lung pathology, but all these are really important to know. And did they spend any time on SCIBU? This may indicate a serious underlying pathology, and it may also be linked to their presenting complaint. So in terms of summary of questions, I know we've rattled through that quite quickly. The main three sections of your neonatal history are prenatal or pregnancy, birth, and the neonatal period. So the main things to ask during pregnancy were, did mum have any infections or problems during pregnancy? Was mum on medication? And were any extra scans needed? In terms of the birth, what type of birth? Was it normal? Was it normal assisted, or was it via C-section? Their weight at birth and their gestation at birth. And last of all, their neonatal period. So did they spend any time on SCIBU or NICU? And did they need any breathing support? Obviously, those are the three main sections, and those are the main questions that you should ask mum. Obviously, depending on the answers to that, it may be a quick yes or no. If they answer yes to that, then go into further detail to find out more information about those different areas of their pregnancy, birth, and neonatal period. So thank you ever so much for listening. I hope that's been useful in helping you learn more about the importance of a neonatal history, but also how to take a good and thorough neonatal history. Thank you ever so much for listening.